All right, everybody, welcome back. Hope you enjoyed your break. Maybe got outside a little bit, enjoying this balmy weather. I'm really excited for this next session. Um, Action planning and best practices around connecting families to community resources. So, kind of a nice follow-up from the scarcity thing and the story that Jen shared about the energy assistance by Stan Kokis. Stan is a former music educator. Stan has had quite a life. If you all don't know him, he's done a million things. I don't know how he's done it in the life that he's had, but he's just full of stories. He has 40 years of combined experience as a public school administrator with responsibility for out-of-school time programs and community partnerships. He's a child care administrator, CEO of a healthcare agency, CEO of a Boys and Girls Club, and has worked as a nonprofit lobbyist. He's worked with members of Congress toward passing the Americans with Disabilities Act. He garnered a White House invitation for the historic Rose Garden signing ceremony, and there was coverage of his efforts in Time magazine. He's been actively involved with the Wisconsin After School Network since its inception in 2005 and served as the network's first elected chairperson, and he is just all around a wonderful man. So I will hand it over to Stan.
Welcome to this recorded webinar provided in partnership by the Wisconsin After School Network, Marshfield Clinic, and the Wisconsin Department of Children and Families. My name is Stan Kokis, and many of you know me as the Wisconsin After School Network's policy lead. But during my lengthy career, I've also served as a chief executive officer of a healthcare organization, a child care administrator, an urban public school administrator with responsibility for out-of-school time. I'll be applying that experience today as we walk through this overview of community resources and family support practices. This session will include a focus on the importance of the work that you do to support not only the children you serve, but their families as well. The result is a healthier and a better community. In addition to this webinar, I encourage you to access a wealth of additional Wisconsin After School Network professional development videos and resources via the links which will be included at the conclusion of this session. And I also encourage you to contact the Wisconsin After School Network for your additional technical assistance needs. We'll be taking a particular look today at the role that you play in directing families that you serve toward accessing community assets that can assist them. Avoiding crisis can negatively impact all members of a household, not just the children. This support that we provide creates healthy families, results in healthy communities, and it's often referred to as a whole child, whole family, whole community approach. And this approach takes on a heightened importance after the COVID pandemic that we all experienced. Early in the pandemic, schools closed, parents lost jobs, and children lost learning opportunities. They lost their stabilizing routines, and they lost social emotional supports. Now, while these initial stressors resulted in immediate effects on children and families overall, the long-term impact remains unknown. Families continue to struggle meeting their basic needs. And by the way, inflation has further exacerbated the ability to make ends meet. It's also important to note that the severity of the pandemic disproportionately impacted children from minoritized populations and those from low-income households. And that impact continues to linger. So let's take a brief look at how the Department of Children and Families looks at the provision of community resources and family supports. As you read the bullet points in front of you, think about two key questions to ask yourselves. What type of resources and community assets have you documented? And what is your specific relationship with those entities that you've documented and their staff and volunteers who provide the necessary support that families can access? An additional question is, with whom have you prioritized building a reciprocal relationship and why? Reciprocity is something that very frequently gets overlooked. How have you communicated, for instance, with foster care providers who may have children and families who are not accessing the type of care that you provide and can refer those children into your setting? As we continue during this webinar, we'll take a more detailed look at how resources can be categorized and organized in a way that addresses that broad range and depth of challenges that families face. As you review the content of the slide in front of you, most, if not all of you, will say to yourselves, we have an array of Family Resource Center information available to those we serve right now. But also ask yourself a key question. How do the families I work with feel about asking for assistance? Do I have a way to assure that the resources are confidentially accessible? Do I have a way to assure that resources are available bilingually? And if so, in what languages? Have you thought about developing confidential peer-to-peer support? Anecdotal information that highlights how assistance was beneficial. For many years, I often heard a phrase in politics that was tied to the phrase, pull yourself up by the bootstraps. And a lot of us realize that some people didn't have boots that they could pull up. Or we also heard some stereotypical welfare mom and dad stories. You know, those individuals who are willingly living on government handouts. You, with your trusting relationships with the children and the families you serve, are in a unique position to assist families without stigmatizing them or having them feel as though they're forfeiting their dignity by asking for help, reinforcing that seeking a hand up is not a hand out. That is critically important. Also be cognizant that asking for help can be additional challenging for families that are culturally patriarchal. Seeking your assistance can be interpreted by a father that he's failed in his responsibility to be the hunter-gatherer. You also take a look at something we often refer to as direct advocacy. Merely referring families to resources doesn't guarantee they will access those resources. There may be concern or fear that those agencies or organizations may report them for whatever reason to another agency. Now, whether that's rooted or grounded in reality isn't the important factor. The issue becomes eliminating any barrier to seeking assistance. So let's talk a little bit about what it means to be a community resource navigator. A resource navigator, generally someone that is well trained, is a designated staff member, or it could be more staff members, who other staff members who work in a line capacity can refer a family to when that family indicates they're in need of some form of support. But again, I would reemphasize there is value in each staff member in a setting being trained to understand how to potentially identify families in distress and engaging them in private dialogue regarding their needs. And that's a very important key point. How do you approach that family privately? It can be with a phrase as simple as, how are you doing? That's far more effective than offering to conduct an assessment. Not many people will respond positively to being assessed, but they will respond to a caring, thoughtful request as to how can I assist you in meeting the challenges that you're attempting to cope with. And most importantly, on your part as providers, the phrase, how can we help? This is a big one that I point to, access to healthcare and mental health services. It's one of the reasons we're going to talk in a bit about social determinants of health, which has a strong healthcare role. Some of the items on this slide may take on heightened importance as driven by a situation. So for instance, after March 31st of this year, Badger Care Plus recipients have to return to pre-pandemic process of reapplying and being reevaluated for coverage. This represents an opportunity for you as a care provider to be proactive in providing assistance versus being reactive. Badger Care will be sending renewal letters to families, but what happens if a family is moved frequently, possibly due to loss of income during the pandemic and the need to find new housing? Will that renewal notice find them? If it does, do those families have access to online technology to create an account and to renew their coverage? Or might they need guidance to an in-house kiosk in your care setting? How you post information about this process will be important, as will providing some direct guidance and assistance toward completing reapplication on the part of a resource navigator. Another example, when it comes to looking at things such as this, we sometimes forget about other services that an adult family member might need to be referred to. One provider not long ago told me about experience when they spoke with a father about assisting the child with some homework assistance. The father, through a trusting relationship with the provider, eventually acknowledged that his literacy skills were very weak and he could not read well enough to assist his child. His level of reading skill also was creating a barrier to him being successful in the workplace. That care provider made an immediate call to a literary service in its local community, a community literacy service that provided reading assistance for adults. The father was referred, went willingly, was accompanied for the very first visit by a member of the program service provider, the child care provider. Long story made short, 1 year later, the father was reading at a 5th grade level, had received a promotion at work, and was enjoying working with his child on some elements of homework. Think in terms of what are we offering not only right now, but what could we add to the mix that we haven't added, such as victims assistance resources. What about someone in a domestic violence situation who could be eligible for other financial support through the legal system? So many things that we can take a look at that expand your reach and expand your approach. So let's talk a little bit about social determinants of health. What social determinants of health are is really conditions in the environments where people live. Includes us as well. Where you're born, where you live, where you learn, where you work, where you play, where you worship, and your age all affects a wide range of health, functioning, and quality of life outcomes and risks. Social determinants of health affect all members of a family. So as you look at this, generally when we talk about social determinants of health, there are 5 domains or categories that frequently are referenced in which you could look to assist individuals in seeking to receive assistance. We categorize these various community assets according to these domains so that we can build relationships with those entities that provide community services within those domains. You may look at this and you'll note right away that we've included a separate 6th domain for food, primarily because we've received a lot of information indicating a significant pronounced deficit that's affecting healthy nutritional options for families facing economic challenges. But again, as you look through this, you will see a variety of things that you could be working to connect a family toward. If you have a family who has a child in your care and the parent is pending a job layoff, what is your capacity to connect that parent with local community resources that could find another job and not disrupt that child's care or result in the child leaving your care altogether? So this slide I lifted directly from a Department of Children and Families document that talks about engaging families in general. Really, it captures a lot of those elements we just spoke of related to whole child, whole family, whole community. We know that communication is extremely important. We know that meeting needs of the family, no matter how broad those needs are important. And also the feedback families can provide to you about their experiences can guide you in being more effective in what you do in the future with additional families. Many of you do a great job now in terms of your collaborative activities with families. You have learning experiences and opportunities for families in general to participate in activities that create educational stimulus. But I want you to think in terms also of how you can do collaborative activities with providers in your community who will come in and be able to walk through a variety of things directly with families. It need not always be directly related to a specific crisis type of issue. One provider recently told me of a very interesting way that they attracted a very large turnout for a family engagement night. They arranged for 5 cell phone providers to come in and look at people's phones and take care of issues they may have been having that was hindering the effective use of that phone, its reception or other features. That opened up the door then for additional parent-child communication opportunities that evening. So again, be mindful of the creative and broad-based ways that you can coalesce a variety of resources in your community. So many community organizations focus on needs or deficits within the community, and every community has needs that should be addressed. But it's also possible to focus on assets and strengths that emphasize what a community does have and not necessarily on what it doesn't have. So Resource Navigator is a key part of that community assessment and identifying assets. So let me go a little more deeply into what you're seeing in front of you. An asset, when it's a person, can be reaching out to people who are empowered to utilize their abilities to build and transform the community. You may use a person in as basic a role as grandmothers coming in to reading to children, but a stay-at-home mom or dad who organizes a play group can be another useful in-person asset. An informal neighborhood leader who can get families connected, especially if families are new to that neighborhood. The physical structure of place, we sometimes don't think as broadly as we should. We think school, we think church, sometimes we think hospital and healthcare providers, libraries, a recreation center, social clubs, in however a setting those may occur. Neighborhood park associations could be the social club, can be a town landmark, might also be an unused building that could house a community center, second floor room for community meetings, a variety of things that you as a provider could look toward that may add some resources that families don't currently have that they indicate that they would find to be useful in connecting with others to build a community relationship. We all know community services make life better, and that's generally for all community members, whether it's transportation, early childhood education, cultural organizations, dropping down to a business. I've had many providers tell me that for those family engagement nights, they brought in multiple financial institutions who have talked to families who have no current credit to establish a very basic checking account so they can develop credit. Some banks have come in and explained to families what it means to have an automobile loan or a home mortgage, taking nothing for granted, giving assets and resources that facilitate the family's ability to move forward and enhance a quality of life. And you, in the end, you're a valued child care member who's intrinsic to community. Without you, many families can't function in the workplace. They don't know if their child is in a safe, structured environment. So you are critical not only to the care of the child, but to the health and wellness of a community economy. So demonstrating evidence of implemented practice is yet one more expectation of the Department of Children and Families. Some of the ways that you develop and document your effectiveness is through your communication tools. How are you communicating with families? Are you using a variety of communication tools, especially for families who may lack access to the internet? Many years ago, and I'm giving away a little bit of age here, as a child care administrator, we used to keep a approximately 5 or 6 inch thick binder that listed the types of community assets that were available. Now a great deal of that can be done electronically. How do you post things in a timely fashion within your entryway, such as the Badge of Care re-enrollment that we spoke of earlier? Meeting agendas are also a good way to demonstrate that you expanded your reach by meeting family needs with a broader range of resources. Staff and family handbooks. How do you delve into the aspect of what it means within a staff handbook to be effective as a family resource navigator? And families being aware in their handbook that a family resource navigator is in fact available to them. What I also will start walking you forward is to think about how will you demonstrate and document that what you did had impact. What was the result of a referral you made, and what might be a need for ongoing support? So partnership agreements and memorandums of understanding don't need to be extremely difficult to put together. One of the reasons that I like partnership agreements and memorandums of understanding is they reinforce something I spoke to briefly earlier in this webinar about reciprocal relationships. An MOU really can talk about what are the roles of both parties, not only in what you do, but how will you connect the families that you work with. Using event flyers to be branded by local business and corporate entities who are actually paying a fee to allow themselves to be branded. That fee is allowing some programs to buy additional supplies that are necessary to provide a quality experience for children in care. Documenting how a relationship was initiated, I think, is extremely important. Again, how was it initiated? Did you approach a family? Did a family approach you? How did you sustain the relationship? The result of the relationship? How did it end? Is it ongoing? So, again, these are steps that also appear in the Department of Children and Families benchmarks for demonstrating effectiveness. Translation services can be extremely challenging, but with a partnership with other local human services providers, you can find pathways to additional means by which translation services might be available to you at low or no cost when you need documents translated. Materials for diverse family structures. I keep pointing to the reality that we have same-sex couples bringing children for care. How are they made to feel comfortable? How is the material presented for them, making them feel comfortable? What are those types of written communications that you utilize? Again, taking care about language, avoiding terms that may stigmatize. So let's talk a little bit about program evaluation. A lot of times we gravitate toward evaluation because it might simply be required by the funding source. Sometimes we take a look at evaluation to demonstrate that the program is in fact being effective. If we referred a family to a resource, did they access the resource? Did it benefit them? If they didn't access it, why didn't they access it? Sometimes we also have to justify the expenditures. If we are going to pay for additional training for someone on staff to be well trained as a community resource navigator, has that expense justified the number of families that utilize that staff position? That also can support you when you make a quest in the community for philanthropic, business, or corporate support for your community resource navigators. So that's part of managing your limited resources. This is important. When you evaluate the actions and steps you've taken, how did it improve what you were doing? Did you change the way you implemented an approach? And if so, how did that change its effectiveness? You also want to document your program accomplishments. Sometimes that's more than just numbers. What's that anecdotal information that families can provide you, and do so if they wish to, confidentially and anonymously? However, their stories remain compelling when you share those stories to community funders and policymakers, both on a governmental level locally and perhaps the state of Wisconsin, as they look in the coming weeks, the biennial budget. Child care counts will be in need of funding. We also look at things you do might be effective in being also adopted by other partners you work with in the child care industries. I always applaud how child care settings do not resist sharing their success stories out of a concern that they will create someone else who will challenge their market share. Simply hasn't been the case, and I applaud you for that. So marketing promotional purposes, I think anytime you can demonstrate that you have effective community resource navigation that works with families to be successful in the community, it's a great marketing tool. So let's talk about the two kinds of key evaluation. Process evaluation is really about the degree to which activities are being implemented and delivered and done so as planned. An example I would give you would be 10 children came to this session to improve their literacy skill, but did we determine in any way where they improved in their reading skill at a later point in time? Perhaps an example I would give you is many years ago, I was an evaluator for the largest food pantry in the state of Wisconsin, and I asked, what are you measuring to demonstrate your impact? They proudly indicated we gave away 30,000 bags of groceries last year. I said, that's really great. Do you know if the people you gave them to actually ate the groceries? Did they trade them away? Did some of it spoil because it was unused? Did they know how to prepare the food? This agency then looked at adding nutritionists to work with clients who received those bags of groceries. Those nutritionists worked with their physicians to see if their particular medical condition had improved due to improved nutrition. So they were able to demonstrate not only the number of items that were handed to a client, but what was the result of consuming, preparing, and in fact improving their nutrition as a result. Is what you're doing reaching the intended target audience? You'll be able to determine that pretty effectively by documenting, are you working with all members of a family? So for instance, after a child leaves your care, is the child in the care of perhaps a grandparent for additional hours until the parent returns home from work? Are you working to provide assistance to a grandparent during those additional care hours? And of course, are you producing the desired outputs, results, and impact, which we'll cover a bit in the next slide, please. Process examples again before we move on to outcome is, how many did you train to be community resource navigators? How many memorandums of understanding have you crafted? Number of families for assistance, number of satisfaction surveys you issued. So the outcome evaluation assesses that effectiveness. It focuses on asking what happened to program participants and what made a difference. So outcome, or sometimes called impact evaluations, are something you do when you want to know how well the objectives of a program were met. Did they change comprehension and understanding? Does a parent better understand, for instance, what to do if they're facing a utility shutoff? Do they know where to go? How to work with another organization, or to come to you for assistance, for you to serve as an advocate? What I always suggest you do is to document the number of families that met with your community resource navigator or spoke to staff who indicated they needed assistance, and then worked with you to directly achieve that assistance or sought assistance successfully on their own. Did they avoid being evicted? Did they avoid a utility shutoff, a loss of employment? And was it tied to your ability to connect them to those services? Another key one as we talk about social determinants of health is, can you assist them in accessing health care when they may lack insurance and have other barriers that are preventing them from seeking health care? It could be a language barrier that you are not aware of. Even asking families, do you have a better understanding of how to access your community resources? And documenting the number of families and the percentage of families overall that indicate to you that in fact they benefited from the services you provided through community resource navigation. So you've had a lot come at you today here. Really what I want to emphasize to you is, think of this as a very simple 3-step progression. You're really trying to have a diverse, comprehensive collection of community resources and assets. And remember, you want those assets to be a wide variety. You want it to be a person. Have you reached out to civic organizations, demonstrating to them the types of skills you may need? Individuals who may wish to volunteer to be of support with you. That physical structure and places that we talked about. Can a family go to a local library and access the computers that are available to seek out additional information that you may have provided when you are not available to allow that family to have access to a computer? Again, that variety of community resources. Are you thinking as broadly as possible to meet all your family needs, some of which you may not be meeting now, but you can identify through community resource navigation? Again, businesses, they want to invest in things that are successful. Business looks to have a return on investment, an ROI, but also the opportunity to market what they have to make available to your families. And again, you are a key asset. You effectively guide and assist families in accessing the resources they need Simply having that pool, that collection, that wealth of resources doesn't guarantee that a family will be able to access them due to a variety of barriers that you can assist the family in addressing. That third box, document that impact, document that outcome, indicate those resources that you compile to better assist families and how you will improve upon those as you continue to move forward in the future. Save this one for last. Obviously, you've accessed this video today and may be aware that there's a wealth of additional videos, printed resource materials, technical assistance that the Wisconsin After School Network can make available to you. What I've included there is an email address through our critical key partner, Marshfield Clinic, and you can direct your inquiries to that email address. I guarantee you a staff member will respond in a timely fashion. We really do appreciate the opportunity to provide you with additional materials covering areas of various information that we looked at during this webinar experience today. We also do have additional videos that are available on the Wisconsin After School Network YouTube channel. And this is a very, very wide variety of videos. I was looking at some statistical data earlier this morning indicating that more than 1,600 single individuals in the last year have accessed some form of Wisconsin After School Network professional development training, the majority of which is available at no cost. I encourage you to consider all of these available resources and do know that we really do truly enjoy getting these resources out to you and answering any additional questions you may have. So what I would close with saying to you is thank you for taking the time to view this recorded webinar. And thank you for all that you do to support a healthier, happier community, which begins with healthier children and healthier families. You're important. What you do matters. Again, thank you. Have a great day. We look forward to working with you in the future.
All right. Thanks again to Stan for preparing that presentation for us in advance and so that we could listen to all that really valuable information. Lindsay, our MC for the day, just had to step away briefly, so I am going to facilitate any questions that you all have after that presentation. Stan obviously was not able to be here in person, but we are definitely able to shoot questions his way and have a conversation as a group to make sure that all that good information is stewing and that you're getting all of your questions answered. So first I'll give people a chance to either unmute or type in the chat if you thought of any additional questions along the way or have any wonderings from that information. I'll just share something that stood out to me. I actually come from a social work background, and something that Stan said, he said, it's really important to assist versus assess. And that really, like, my ears opened up when he said that because so much a part of my everyday language and a part of what social workers talk about is that assessment piece. And that's just something we don't even think about because it's part of our job and we're helpers. And so we naturally go to that place. So I think there's a lot of crossover where a lot of times we think we're helping, but even just the words that we use can either shut doors or open doors for people. So I think that's really valuable to think about it that way. And it makes it an easier task to tackle as well when we're just thinking about this is just assisting a family. It's just doing that one extra step or connecting them to one other resource. It becomes a lot more manageable. I know Kelly said in the chat, there's a lot to think about there. It's a lot for programs to think about. Like these are best practices. And what else can we be doing when I know you all already have very busy days in your programs for sure. So definitely is a lot to think about.
I'm going to add just a really quick thought. I know I'm kind of old school. I like paper, and I really appreciated Stan's comment about having a binder of resources. And I do think that we can find most of those resources digitally, but it's really nice in the moment when you're maybe working with a family or addressing a specific situation to have something readily available. And in our after school program, we had a binder at the front desk that had all kinds of information in it. And it was really just convenient to have it available, that, we took the time to kind of do the extra work up front to create that resource so that it was available when we needed it. And we didn't have to go searching or saying, I'll get back to you tomorrow. I mean, you really want to capture people in the moment when they're willing to accept help and not put it off. And so, I think really thinking about, do you have documentation or those resources available kind of in an easy and ready to go format in your program so that you can grab it if you need it.
Yeah, and I think that ties nicely even with what Lindsay was saying before, where like then we don't have to operate from that place of scarcity, like, oh no, we don't have enough time, we have to find these things. It's kind of just thinking about what are your families needing to access on a regular basis and what can you have on hand. And that can always be like a growing document or a growing binder, and it can be changing all the time, but just having access to those things. Absolutely. Is anyone else thinking of any comments after hearing Stan's presentation at all?
I see there's some comments in the chat, Rachel.
Yeah, I was just reading that. So in addition to just like the physical binder, really talking about cultivating those relationships so that you have that relationship to back up what you're referring people to, right? That makes a difference if you can do a warm handoff and make sure that the family or the child that you're connecting actually has that physical person. It goes a long way. And instead of just a nameless, and Stan referenced it too, these systems can be scary for families. So we want to make sure they have that warm connection for sure. The warm handoffs, yeah. It's really expanding that support system for the family so that it's not just necessarily all on one provider, but it's just expanding that pool of resources. Yeah, shared releases, and that cuts through some of the red tape as well. And Stan mentioned that with his MOU, so thanks, Claire, for backing us up on that too. Just having that ability to communicate freely goes a long way. So doing that on the front end and making sure those MOUs or whatever, those releases are in place so that then when a family needs something, it's an easy referral, and then it's not those extra steps of getting those permissions. Just thinking about that on the front end can be really impactful. Absolutely. Another thing I was thinking about as I was listening to Stan is just how supporting a family in one area has the potential to just impact and like kind of be a domino effect. I was talking to a provider just last week who was talking about helping one of the tribes redo their playground for kids. And really, I think she called it like rewilding and making the playground like back to the original trees, the original soils, the original plants. And so that improved like the surrounding environment literally, but it also had a very big, meaningful cultural impact. And like it was an opportunity for the tribe to have some healing around that and to kind of have some ownership and say over how a program was run. And so that was very powerful in a lot of different reasons. So you can see how that would impact health for the kids participating in that program in many different ways as they're able to move freely in an environment that reflects where they come from and where their people come from. Yeah, thanks, Brittany. So you're also talking about the importance of following up and just being that connector. So it's one thing to refer a family or connect them, but then making sure they have the support they need afterwards can make a big difference. and then asking if it was helpful. So that's giving you feedback to see if we're on the right page and we're connecting people to the right resources, or if we have to change course as well. Yeah. Yeah, Lindsay, I think this one generated a lot of thoughts and a lot of ideas are kind of coming in on this one.
Yeah, I just want to echo what Brittany said. I think that oftentimes if we just hand someone off and don't follow up, it seems like we're just trying to get rid of them as our problem. And just a gentle follow, even if, you know, even if it's like not a big thing, just like, oh, hey, how'd that go for you? Was that helpful? That alone just shows like you care about the person. And the handoff wasn't to get someone off your plate, it was to really connect them with the resource. So it really sort of changes the whole dynamic of what that can feel like if you're sort of on the receiving end of that. Thank you, Rachel, for stepping in while I had to handle a little minor family emergency, but we're fine. I'm back. And thanks to Stan. He's always just a wealth of information and experiences and ways of thinking about things. I learn something from him every time I hear him talk. So I hope you all got a lot out of that as well. Oh yeah, privacy is also really important, privacy and confidentiality. And I think being really clear about what your sort of practices or your policies are around that can go a long way as well. Like making sure that it's transparent, that you protect people's privacy and that, you know, conversations are confidential and that kind of thing can help start to establish that trust. But that trusted relationship is really, really, really critical. Okay, so it is time for another break. We'll be back at 10:55 for our third presentation today, which is going to be about transportation.